I'm Dr. Mandy from Crazy Mountain Vet Service. Today, Lori and I are going to talk to you about anesthesia and what happens when your dog has to come undergo anesthesia or sedation.
What are the different types of anesthesia?
Well, there's different levels. So sometimes we just need to sedate your dog a little bit to get them to let us do what we need to do to help them. So we might give them just light sedation, which will just make them sleepy and a little bit easier to handle. And we might use a local numbing to do if we need to fix a toenail or do sutures or something like that, we might just use local and mild sedation. But sometimes we need to do more, like when we do spays and neuters, we need them completely under anesthesia. So we'll use inhalant anesthesia for that. And to do that, we do sedate them first, and then we give them an IV drug, usually that makes them go completely under, and then we put a tube down their throat so they can breathe inhalant anesthesia. That way we have an airway, we can control everything while they're under. If they need more or less anesthesia, we can regulate that. So that's what we need for in-depth procedures.
Are any particular dog breeds more sensitive to anesthesia?
Usually short-nosed breeds are a little more susceptible to anesthesia just because they have less airway, so their breathing already is difficult. Although I usually feel better when I can get a tube down one of their throats because I feel like they're breathing better than they ever have before. But they are generally the highest anesthetic risk. That and older dogs, just because a lot of the medications we use can have some effects on liver and kidney. So we try to be really careful about that and check that before anesthesia, but those animals can be a little bit more susceptible to side effects or sensitive to anesthesia.
What do I need to know before my dog comes in for an anesthetic procedure?
So generally we will go over those things with you, but you need to know that the dog is going to be probably put all the way under. So, they may be a little sedated when you come to pick them up. They may not feel like eating well that night. If there's other concerns that we have before the procedure, we may want to do blood work just to see that everything looks okay and we feel comfortable that we can support the animal well under anesthesia. And we'll always ask you, if we know that there's a procedure we need to do, we'll always ask you to fast. Sometimes in emergency situations, we can't do that. But the fasting is just so that they don't vomit or aspirate when they're waking up from anesthesia. It's just a little easier to keep them safe while they're waking up or going under. But generally, most dogs, the day after surgery, they never knew anything happened. The night of, they may be a little sleepy, may not want to eat. Sometimes they feel a little nauseous, kind of like you or me if we have to get anesthesia done.
What are some possible complications of anesthesia that my dog could experience?
Most of the time, the complications that we see is extended period of sedation. So sometimes a dog doesn't wake up as fast or as well as we would like them to, but that's pretty rare. And most of the medications that we use are short acting, and so, or we can reverse them. Severe complications would be, if they have some side effects to the medications that we give them, that makes them have like an allergic reaction or something like that, or if they are already have some underlying kidney or liver disease that we make worse by the drugs we give. But in general, anesthesia is pretty safe. Like we try to mitigate any risks by doing blood work at a time and supporting them while they're under. And we have an airway the whole time. I mean, I feel like they're almost safer under anesthesia than they are at other times. So.
What monitoring will be done by the veterinarian staff to ensure my dog is safe while undergoing anesthesia?
So we will have a vet assistant monitoring respiratory rate and heart rate and also oxygen saturation. And those things just kind of tell us what plane of anesthesia the dog is at or the animal is at, and also just help us support if there's anything that needs to be adjusted. We can do that.
What do I need to watch for at home after my dog has undergone anesthesia?
The biggest thing you'll probably notice is that they will be usually are a little more subdued that night. They won't want to do as much. They'll kind of want to sleep. You need to keep them warm. Need to feed them a small meal. They don't always want to eat the night of surgery, so they might be a little bit nauseous. Sometimes if they've had a very painful procedure, they may be a little uncomfortable that night, and that's something you would want to reach out to us about. But generally we try to assess their pain before they go home, and if we feel like they're going to need extra pain meds, we would send those home with you. But often they'll just feel off, like they might feel a little nauseous, they might be a little whiny. But generally by the next day, they're perfectly back to normal.
Nice.
If you have any questions about your dog undergoing anesthesia, please feel free to give us a call and we will help you out any way we can.